Hi everybody, in this video we are going to discuss about the topic called as drugs and alcohol abuse. Drugs and alcohol abuse. So in this video, first we will be discussing about the sedatives. Okay, first we are going to discuss about the sedatives. Otherwise we call them as hypnotics. Okay, we call them as hypnotics. Okay, we are also calling them as hypnotics, and moreover they are called as tranquilizers. Okay, they are called as tranquilizers. Please remember this. Okay, sedatives. Otherwise we are simply calling them as hypnotics. Okay, hypnotics. Otherwise, they are commonly called as the tranquilizers. Okay, tranquilizers. So these sedatives are having some basic characteristics, like when a person uses these drugs called as sedatives. Okay, they reduce the activity of the brain. These sedatives, the drugs which are coming under the sedatives, will reduce the activity of the brain. Okay, they reduce the activity of the brain and produce a feeling of calmness. When they take these sedatives, they feel that they are very calm. Okay, they feel that they are very calm, and the brain is also, the activity of the brain is also slowed down, and they feel that they are very relaxed and drowsiness. Okay, and it causes drowsiness. So these are all the basic points or characteristics of the sedatives. Okay, sedatives. Okay, characteristics of the sedatives. So some of the or two important groups or sedatives we will see. The first one is called as barbiturates. Okay, barbiturates. Okay, barbiturates are a type of what? Sedatives, hypnotics, or otherwise called as tranquilizers. And these barbiturates are the derivatives. The derivatives of barbiturates are urea and malonic acid. Please remember, what are the derivatives of the barbituric acid? Okay, what are the derivatives of barbituric acid? They are urea and malonic acid. Okay, are the derivatives of barbituric acid. Okay, we have to remember that. Okay, please remember that. So here we will now talk about this. Okay, we will now talk about this. What is the cause of the barbiturates? Okay, it will cause or it will induce sleep. Okay, it will induce the sleep. Okay, it will induce the sleep. Okay, so here directly point is that when a person uses these drugs called as barbiturates, they will cause what? Sleep. Okay, they will induce the sleep. Okay, please remember this. And the second one, okay, the second one is benzodiazepines. Okay, benzodiazepines. So these are also a type of sedatives only. When a person uses these drugs called as benzodiazepines, it hastens sleep. Okay, means what? The person will feel more sleepy. Okay, some people will be there in the society where they will not feel sleepy. Okay, they will be disturbed. So, but when a person uses these drugs called as benzodiazepines, it will cause the sleep. It hastens sleep and reduce intermittent awakening and increases total sleep time. Means what? Means what? They will not be disturbed in the sleep. Some people will be having disturbed sleep. For every few hours or maybe for 1 hour or half an hour, they will get awake. They will be awake and they will have disturbed sleep, we call it as. They will not have a more good sleep. Okay, so that will be overcome by using these drugs called as benzodiazepines. Okay, so here we have to remember that when a person uses this drug called as benzodiazepines, it reduces intermittent awakening and increasing what? The total sleep time. The sleep time will be increased. He will be having more sleep time without any disturbance. So that is the drug called as benzodiazepines. Okay, benzodiazepines. So here the next one is hallucinogens. Okay, hallucinogens, which alters perception, thoughts and feelings. Okay, these drugs will alter the perception, thoughts and feelings. And here please remember, it is lysergic acid diethyl amide. Okay, they are obtained as lysergic acid diethyl amide, and in short we are calling it as what? LSD. And please remember, this is a very important term. Okay, lysergic acid diethyl amide. And this particular drug is obtained from the ergot. Okay, from the ergot. Ergot means what? It is the extract from fruiting body of fungus. And we already said and studied in the first video about the drugs, stating that drugs are obtained. Okay, drugs are obtained from the flowering plants and also from the fungus. So here is the fungus which we are coming across, where it can cause hallucinations. Okay, so here this drug LSD, okay, lysergic acid diethyl amide, is a drug which is obtained from the ergot. Ergot is the extract from fruiting body of fungus. Okay, it is extract from the fruiting body of fungus. Now what is the name of that fungus? The name of the fungus is Claviceps purpurea. Okay, Claviceps purpurea. Please remember the name of the fungi. Okay, Claviceps purpurea is the fungi from which drug is obtained means lysergic acid diethylamide. So remember that this is nothing but what? It is a drug. Okay, it is a drug that is obtained from a fungi called as Claviceps purpurea. Okay, Claviceps purpurea. And this particular drug can cause various effects on the body. Okay, nightmares. Okay, frightening dreams. Okay, frightening dreams can cause frightening dreams, which we have called them as what? Nightmares. Okay, nightmares. And they feel when a person takes this, okay, this particular drug, he feels that he is in floating sensation. Okay, he is in floating sensation, and he will be affected with what? Hallucination. Okay, he will be also affected with hallucination. Things that are not there in front. He feels that all that those are happening. Okay, all those are happening. He feels. That's why we said feelings. Thoughts will be different. Okay, thoughts and his perception. Okay, all these will be changing. So that we are calling it as hallucination. So these are all the effects which can be seen or identified when a person is taking the drugs. Okay, such as the lysergic acid diethylamide. And the next one is we will be discussing smoking. Smoking is a very common point or topic, or we are coming across many people who will be smoking. Okay, who will be smoking, but they know the dangerous hazards of smoking, but still it is more prevalent in this society, which means it is spreading so much. It is spreading so much in the society. So we are going to discuss now about smoking. Okay, in smoking they are used tobacco. Okay, this tobacco is used for more than 100 years. Okay, it is being used for more than 100 years, and tobacco is smoked or chewed or snuffed, means inhaled. Snuffed means in the form of powder, and they will be inhaling it. And it contains what? The tobacco, okay, which is used in smoking, is containing what? A chemical called as nicotine. It is an alkaloid. Please remember this, a very important point. Okay, a chemical called as nicotine, which is an alkaloid. Okay, which is an alkaloid. And this particular nicotine, stimulates. Please remember, nicotine stimulates. Okay, it is stimulating the adrenal gland. Okay, nicotine, when it is taken inside into the body, it stimulates the adrenal gland, and this adrenal gland, we know that it is responsible for producing hormones. So adrenal gland will be stimulated to produce two hormones called as the adrenaline and another hormone called as noradrenaline, and these two are produced or released more in quantity into the blood. So when these two, what are those hormones called as adrenaline and noradrenaline, when they are released more into the blood, there are chances that these two drugs, these two hormones can increase blood pressure, and also the heart rate. So nicotine is very dangerous. Okay, nicotine is very dangerous, which is leading to what? Increase in blood pressure and increase in heart rate. Okay, increase in heart rate. It is all because nicotine is stimulating the adrenal gland to produce two hormones more in quantity, which are called as adrenaline and noradrenaline. And here smoking, by smoking tobacco, it can cause different types of cancers, such as lung cancer, urinary bladder cancer, and also throat cancer. And it can even cause bronchitis. It even damages the bronchus. And emphysema means improper breathing. They cannot breathe properly, which is called as emphysema. And by smoking, it also causes what? Coronary heart diseases, which we already said, it is affecting the heart rate, which means it can cause coronary heart diseases, and at the same time leading to the gastric ulcers. So these are all caused just because of what? Smoking. And not only smoking, tobacco is not only smoked, but it is also chewed by some people. Chewing tobacco can cause again various dangerous points, dangerous effects here. Chewing tobacco can cause oral cancer, mouth cancer, and it increases carbon dioxide in the blood. We know that there is a pigment called as hemoglobin, which binds with the carbon dioxide and it also binds with what? Oxygen. But here, when there is increase in carbon monoxide due to smoking, this carbon monoxide will be bound to the hemoglobin and not allowing the oxygen to bound to the hemoglobin. Okay, because we know that hemoglobin will show more affinity towards the concentration of a particular gas like carbon dioxide or the carbon monoxide. So when there is more carbon monoxide, it goes and binds to the hemoglobin, not allowing the oxygen to come and bind to the hemoglobin. So that's why there will be less supply of oxygen to the body parts. So it reduces, okay, the supply of oxygen to various body parts. So that's why we are saying it as increase in carbon monoxide in the blood causing oxygen deficiency. Oxygen deficiency we are saying. So here we all know that, you know, on the cigarette packets it will be given as smoking is injurious to health. Smoking is injurious to health because it causes what? Cancer, and also either it is in the form of smoking or either it is in the form of chewing tobacco. It is causing various effects, especially dangerous cancer, lung cancer, throat cancer, okay, oral cancer will be caused. So keeping these in mind, still there are many people who are addicted for smoking in the society. It is the most prevalent, okay, it is the most prevalent in this society, means it is the most important, okay, one which is spreading in the society, which is nothing but smoking. Smoking is spreaded throughout many, okay, it is been okay, taken as an addiction by many young people. So that's why the young people should be counseled, okay, all the young people should be counseled that they should not smoke and they should go for medical help, okay, they should also go for medical help. These 2 points are important for the young people who should not get addicted for this, okay, addiction called as smoking. And please remember, you may think that, okay, I am not smoking, but in the places where people will be smoking more, we should not be there, okay, we should not be there, because more than a person who is smoking, the passive smoker will be affected. Passive smoker means what? The one who is standing next to the person who is smoking. Okay, if you and I are standing next to the person who is continuously smoking, when he is releasing that smoke and that smoke is inhaled by the next person, the person may also get, there are more chances that that person who is not smoking, called as passive smoker, will also be affected with the cancer. Please remember that, will also be affected with the cancer. So these are the points which we should keep in mind when we are discussing about the smoking, okay, when we are discussing about the smoking. Thank you so much.